We are live now.
Namaskar. I'm Dr. Mukul Kumar Sharma, HOD of English Department, Bapuji College, Sorokhetri, Assam. মই ডক্টৰ মুকুল শৰ্মাই কৈছো মই বাপুজি মহাবিদ্যালয়ৰ ইংৰাজী বিভাগৰ মুৰব্বী অধ্যাপক On behalf of Anazuri, we are going to start our session on gender and sexuality now. Anazuri hoy moi লিংগ আৰু যৌনতা শীৰ্ষক আলোচনা চক্ৰ আৰম্ভ কৰিব লৈছো We have among us Dr. Nobonil Borua, who is a pioneer doctor in neurological surgery of Assam and the entire Northeast. Amar logot ase Dr. Nobonil Borua, june neurological surgery neurological বিষয়ৰ শৈল চিকিৎসাৰ এজন অগ্ৰগামী চিকিৎসক অসম আৰু গোটেই উত্তৰ পূৰ্বাঞ্চলৰ আমি আজি যেটো বিষয় আলোচনা কৰিম হেতু হল patient's perception of female doctors. Is it as per with their male counterparts? আমাৰ আলোচনাৰ বিষয়টো হৈছে ৰোগী সকলৰ মহিলা চিকিৎসকৰ বিষয়ে থকা যেটো দৃষ্টিভংগী এটো বাৰু পুৰুষ চিকিৎসক সকলৰ প্ৰতি থকা দৃষ্টিভংগীৰ সমকক্ষ নেকি Let me introduce Anazuri a little bit. Muk Anazuri বিষয়ে অকমান ক'ব দিয়ক Anazuri is an organization which is promoting education in different areas. Anazuri এটা এনেকুৱা অনুষ্ঠান যোনে কিছুমান নিৰ্দিষ্ট বিষয়ত শিক্ষাৰ প্ৰকাৰৰ কাম কৰি আছে যাৰ মাজত লিংগ আৰু যৌনতাও এটা Anazuri আৰম্ভ কৰিছিলে সামাজিক কৰ্মী Milin Dr. Dangoriai 2018 sonot. Anazuri was founded by social activist Milin Dr. In 2018. So I welcome Dr. Nobonil Borua to today's session. Dr. Nobonil Borua moi আজি আমাৰ অনুষ্ঠানলে আদৰণি জনাইছো নমস্কাৰ Dr. Borua
Namaskar.
Hi. Dhanyabad. Let me introduce Dr. Borua a little bit. As I said, he is a pioneering neurosurgeon of Assam and of entire Northeast. He has pioneered very important surgeries in Assam and entire Northeast, and he was an ex-member of Neurotrauma Society of India. মোৰ প্ৰথম প্ৰশ্নটো হ'ব ডক্টৰ বৰুৱা আপুনি অকমান এৰি বিষয় আপোনাৰ চিকিৎসাৰ কি কিনো কাম কৰিলে বৰঙনিখিনি বিষয় অকমান ক'ব নেকি কি কয় we want to know from you Dr. Borua of your contribution in terms of medical service which you have been rendering so far.
Dhanyabad Dr. Sharma. I have been working in GNRC for the last nearly 24 years. Moi as a neurosurgeon, so normally আমি brain আৰু spinal surgery কৰো. When I came back in 1997, অসমত neurosurgery অলপ infancy আছিল. It wasn't doing many things which a lot of young people do today. বিশেষকৈ aneurysm surgery য'ত brain or blood vessel বিলাক বেলুনৰ নিচিনাকৈ ফুলি যায় that aneurysm surgery probably was started by me then a lot of complicated brain surgery as well as spine surgery বিশেষকৈ spinal fixation বিলাক start কৰিছিলো এনেকুৱা বহুত কিছু কাম কৰিছো নিজৰ কথা নিজে ক'বলৈ বৰ ভাল নালাগে but মই significantly ভাবো যে what I have contributed is that lot of surgery যিবিলাক অসমত নহৈছিল যিটো অসমৰ বাহিৰলৈ মানুহ যাব লাগিছিল people who cannot afford to go outside they benefited from the expertise we brought GNRC মোক help কৰিলে we had technology as well as training I have trained myself abroad several times So a lot of things we have done, which now people don't need to go outside Assam. That is one. And my passion was road traffic accident, because more বেছিভাগ ৱাৰ্ডত দেখো যে যিবিলাক হেড ইঞ্জুৰি পেচেণ্ট সেইবিলাক ইয়াং এডাল্টছ যাৰ জীৱনত বহু সম্ভাৱনা বাকী আছিল, কিন্তু এই হেড ইঞ্জুৰি, ৰেকলেছ ড্ৰাইভিং, হেলমেট নিপিন্ধা ইত্যাদিৰ কাৰণে তেওঁলোকৰ মৃত্যু হয়, আৰু সেইটোৱে মোক যথেষ্ট আঘাত দিছিল. So that's why I took it as a mission, and I got cooperation from the police, from the transport department, and from my hospital. So we started aggressively. My school, college bilakot goi pelai promoted safe driving and safety measures, so to bring down road traffic accidents. So that's my passion. Aru hetu karone moi neurotrauma society, neurotrauma mane brain or injury ba spine or injury, a neurotrauma society of India moi executive member hoisilu, and that happens to be the first time somebody from Northeast got elected into a national body in neurosciences. So hetu korilu. Tar pisot, of course, the passion went further. More at a team developed all over this in this few years. So I have trained up quite a few people, including surgeons from neighboring states. Tar pisot ji hokole onno jagat training loi ase, teoluke ahi partially motor training loisil. So that way I have contributed to development of young neurosurgeons in this region. Teolukok training by teolukok utkah di, encouraging them to do daring surgeries. I have told them that go ahead, do it. If you do the daring surgeries, if anything goes wrong, I am there. Tenage, I have encouraged people to do it. Beyond neurosurgery, moi jitu road traffic er kotha kolu, tar pisot olop activism korilu. Prothomote medical activism, tar pisot social activism korilu. Social activism kori somehow I got accepted as a political commentator too. So people who know me may have seen me in TV in political debates as a political commentator. Then, of course, once I gained my TV experience, I started a talk show, or rather a health show. I hosted a health show where I invited top doctors of Guwahati or Assam and talked about several diseases. So that I ran for quite some time till COVID stopped it. And besides that, I'm also interested in other things. I'm being the son of Louis Conrad Rudra Burwa, I am involved in culture. So I am in the executive of many mobile theaters. I have acted in movies. And yes, that's about it. So about my activities as a neurosurgeon. And one minute, which actually brought me to today's thing is my involvement in the gender issues. It started with in an accidental way. I operated on a HIV positive patient, and then I realized I was the first surgeon in Assam to have operated on a HIV positive. That brought me close to the LGBTQ societies. And then I realized that gender is a very big issue, especially transgender and LGBTQ issues are very, very big, which are often brushed under the carpet. So that's how I got involved into gender issues, and probably that's the reason I am here today.
Okay. Thank you, Dr. Borua. Can you give us a little elaboration regarding your that surgery which you have operated on LGBTQ plus member? Your experience on whatever.
No, actually, I operated on HIV positive. I operated on HIV positive. Yes, LGBTQ also I've operated in the LGBTQ are as normal as anybody else. So there is nothing to discuss in the sense that the society must accept the fact that they are as normal. So I have operated on LGBTQ patients as like any other patient of any other gender. So that is not I don't think that is something needs to be talked about. But HIV positive was, normally surgeons are very scared of HIV positives because they are transmittable. Especially the surgeons are at huge risk. Not only the surgeons, the whole team is at huge risk of getting the disease from the patient. So we take very, very extra precautions. But I thought that since I have all the benefits, the financial, the social benefits of being a surgeon, I also have to take the risks of being a surgeon. So I went ahead and decided, because if the patient was refused, patient had a brain tumor and he was curable, but everybody was refusing because the patient was HIV positive. So came to me And I decided, why not? So I had a pep talk with my team, and everybody got enthused. They all wore protective clothing and everything, right from the cleaner to the assistant to everybody got very enthused. And that's how I first did it. And after that, I have done quite a lot of HIV positives, and not only me. Since I set an example, a lot of other doctors in our hospital have started. Now, I think it's pretty common to do HIV positive, surgeries on HIV positive people.
Thank you, Dr. Borua. Our next question is directly related to our topic. What is the scenario of gender-based discrimination towards female doctors in India as well as in Assam? And what is the scenario in the developed countries?
I will delve into this question a little deep. So allow me some time to answer this question. First of all, why did this issue of gender discrimination come about? I have a feeling, my feeling is that this is a human created. In the wilds, the female lion or the male lion, the female tiger and the male tiger hunt equally. The female only gives birth to the siblings, but the hunting and the physical work is same. Where did the segregation come? When we started domestication of animals. So we started using the bull for plowing and the cow for milk, the female horse for breeding and the male horse for running. But then when we consume, do we bother whether it is a male poultry or female poultry, a male pig or a female pig? We don't. Then when it comes to some work animals like elephants, when they do heavy work, we don't bother about males or females. So this came about as a man-made phenomenon where males started being considered as superior. I don't know who coined the term fairer sex. I think the mindset more এটা অনুভৱ হয় যে এই যে fairer sex বা weaker sex to আচলতে শব্দটো for want of or for decency inferior sex শব্দটো ব্যৱহাৰ নকৰি পেলাই তেওঁলোকে এটা নিজৰ ভুল মাইন্ডসেট এটাৰ কাৰণে they use the word weaker sex. How can a woman be weak? Physically কিছুমান কাম নকৰিব পাৰে, but then weak to হ'ব নোৱাৰে. You cannot consider a woman weak. So that is something which actually I question. Secondly, আৰু এটা কথা আমাৰ আহে যে ট্ৰেন্সজেন্ডাৰ খিনিক আমি সমাজে এতিয়াও একচেপ্ট কৰিবলৈ যথেষ্ট টান পাওঁ, which is ridiculous. There's a male, there's a female, there's a third sex, and they are transgenders. সেইটো মানি ল'ব লাগিব. আমি যে নেমানো সেইটো আমাৰ এটা masochistic এটা attitude আছে where there is a question of male superiority. Now, having said this about creating the background of this gender discrimination, does it exist in health? Our medical world it exists for nokore. Definitely exists for it. If somebody is denying, I think he is living in denial. There's absolutely that history ase. Although female doctors are as old as history. The first recorded lady doctor is called Merit Pitta in the Egyptian empire. That is Pharaoh time out. Merit Pitta was recorded as a female physician. So that is the earliest known. Perhaps a Greek civilization has a lot of female physicians. Medieval society Abbess Hildegard boli Germany tasil. Islamic world female physicians nasil. But interestingly, Islamic world ki asil, there were female apprentices and eunuchs who were used by the physician. The physician would not touch a female patient. It's the female apprentice who would touch according to the physician's instructions. Chinese auto teneke who king in boli first egoraki asil, teoko hei bahiror pa joa Christian missionary train up korisil. But what is interesting, before talking about Assam in India, I find it interesting to talk about what is happening in perhaps the most advanced country in the world, that is US. US, although there were 1848 Elizabeth Blackwell namor lady doctor asil, but between 1930 to 1970, in fact, only 14,000 lady doctors were graduated in US. So right up to 1970, which I think is a modern era. So tar pisot hai lady doctors bahibole lole, but in spite of that, etiao mane he majority lady doctor hoa na etiao somewhere close to 50% hoy ase. But close to 50% dot it'll be what is the discrimination I am talking about? There was a discrimination in terms of intake into medical schools. Medical schools of female were not encouraged to join. They did not get encouragement. Practice of there was discrimination. In 1972, এখন Higher Education Amendment Act হল আৰু 1975 Public Health Service Act pass কৰিবলগীয়া হৈছে. Just imagine 72 and 75. As late as 72 and 75, US on isna jaga to end discrimination of ladies in medical doctors, 2 acts had to be passed. Tarpisot aru eta female society, American Women or Society filed a suit against all general suit against all medical schools to end the discrimination. So tar pisot hai American isna jagat ladies easily medical college seat poa hol. But even then, where does the discrimination start? In terms of promotion, etia at this 21st century telkor goi pelai etia dekha gaise je 38% paise goi female faculty members in US medical schools, and as head of the departments or deans only 16%. So the discrimination is there not just from the patient, in the health administration, in health education, discrimination to definitely ase. Our reverse discrimination jodi saame medical field ote nursing the male population is very low. That is again a perception problem. Ami bhabilo je nursing to female or bostu aru doctory to male, it's a male dominance, which I think is not really right. Even in medical research, scientific research, it is a male dominance. Females do not get. But medical science of female or male or in terms of expertise, in terms of research, I don't see why there should be a difference. How can you have any kind of difference, scientifically speaking? Gender difference yat hoboi nalage, kintu tothapiu hoise. In fact, US or 19th century, we are in 21st century. So less than 200 years ago, female doctors were not rented out. Commercial areas were not rented out to females for practice. They used to take korbar lokor, mane servant quarters, itadi enekwa hire kori pelai, they had to open their chambers. Can you believe it? The US or nisna jagat as late as 19th century, they were not given practice chambers in posh localities or in medical localities where they have. In US and UK, you have that areas. This area is earmarked for medical practice. So in those areas, female doctors, however good they may be, but they were not given the chance. It was the discrimination was so much that separate medical schools and separate hospitals had to be opened for female doctors in 19th century in US. That was the situation in US. Now, coming back to India, India actually did not have female doctors. There was no training. That is a scenario in everything. Forget medical. Even in education, females were always thought to be swalir education dorkar nai, swali jonmo hoy biya diboloi. That was the perception, the wrong perception which existed in society. Swalir jonmo hoy ghor ekhon cholaboloi, biya hoboloi, পঢ়া শুনাৰ দৰকাৰ নাই. The education was specifically reserved for males. So as a result, there were very few female doctors. Anandi Gopal Joshi, Kadambini Ganguly, Mahalakshmi Reddy, ekhokol India's first lady doctors, but they were all trained abroad. India's first trained doctor আছিল Charlotte Eleby বুলি, during British India, and she came in 1884. তাৰপিছত 1884 she needed assistant. So Rukma Bai বুলি এগৰাকী মাৰাঠী লেডিক তেওঁ train up কৰি ললে. Rukma Bai did not have degrees, but Rukma Bai was trained up, and Rukma Bai became a kind of doctor due to training of Charlotte Eleby. And of course, jete Pakistan India part asil, jetu Pakistan occupied Kashmir, that Rehana Kausar boli egoraki 1871 prothom lady doctor asil. That is significant because that the western part of India at that point of time was more of a Islam majority area. So in that area, having a lady doctor, a trained lady doctor, was indeed a big achievement. In Assam, the first lady doctor was Sushila Thomas and Rajani Prabha Dotto around the same time. They were called licentiate medical practitioners. And Nirmala Borua from Dibrugarh did the first, she's the first MBBS. Now, regarding your question, I dwelt into a little history, but regarding specifically answering your question about what kind of discrimination. The first discrimination, of course, is academic discrimination, which I already pointed out, that getting into medical college is a difficult thing. Second discrimination is being in the hierarchy, getting promoted, getting positions of responsibility for a lady doctor is quite difficult in advanced countries also. Very few males would like to be an assistant professor to a head of the department who's a lady. So that kind of thing existed in the past and probably still exists today. Maybe in a reduced scale, or rather a much reduced scale. But if we say that it doesn't exist, I think I'll be lying. That is during work.
What about the patient's perceptions regarding?
Yes, I'm coming to that. That's the third part. And again, in research also, the ladies are behind because they do not get the opportunity. Now, the most important part is the patient's perception. What does it happen? Unfortunately, even today, whether it's Assam or US, there is a bias against lady doctors. People may not openly agree, but especially in surgical fields, yes, they are very happy with a lady gynecologist, or probably a lady pediatrician, a lady pathologist, a lady microbiologist. They do not have much issues. But tell me, anyone present here, have you ever seen a lady orthopedic surgeon? So the bias is that orthopedic surgery should not be a ladies. Why? That's a fable if you say the har jora dibole gat jor lage. No, it is not true. You don't need, the old days are gone. Jor gar jorere manhe surgery korisil hetu din gol. Kintu orthopedics are to etio lady nai, because there is a definite bias by the patient. Patient or bhori hat bhangile lady egorakir hotoi operation korabole jaboloi moi bhabu etio dangor bias eta ase. Mane hetu orthopedics at kotha koiso. Again, in gynecology, of course, because the patients are ladies, because it's a very, very private science, they want ladies. Kintu when it comes to a complication, as a lady doctor, operation gynecological complication, the perception I feel is that they want a second opinion from a male. I think ladies also have the problem, be it a patient, that the male is superior. A perception to not only it's a male thing, I believe it also exists in a female, because jodi onno social events atsai female or atakke besi problem female e kore, be it dowry, be it anything else. So that also exists here. Another problem, female etu moi koisu educated society mal. Suppose the educated society kotha nokoi pela all of slightly less educated but backward society ki hoy, lady doctor egoraki is equated with a nurse. So I asked this question to a lot of my female colleagues, my lady doctor colleagues. So teoloke eta complaint khodai kore je amak patient e sister buli mate. The sister mane nurse buli bhabe. আৰু কেতিয়াবা এনেকুৱা প্ৰশ্ন খুধি দিয়ে যে সিস্টাৰ ডক্টৰ কেতিয়া আহিব. The another reason for this confusion, nurse or আজিকালি ইউনিফর্ম আগৰ নিচিনা নাই. There was a distinct difference of uniform. আজিকালি কিন্তু nurse or ইউনিফর্মও বহুতখিনি similar হল, and there is a new development called nursing practitioner, যি ডক্টৰৰ কামখিনি preliminary কামখিনি কৰে. So they are also kind of doctors. সেই কাৰণে আজিৰ সমাজত আমি the discrimination which we see amongst the patients is they feel lot of them mistake lady doctors as nurses, number one. And number two, as I said, they have a crisis of confidence on lady doctors in fields other than gynae and pediatrics. Baki bilak field, more field to khub kom. As a general surgeon, moi jetia PG kori asilo tetia, there was only one general surgeon who was studying with us. So that is the situation. Answering your question in that way.
Thank you, Dr. Borua. In Assam, if we see the medical scenario in private arena, what we see that male doctors are always in demand, and in terms of fame also they are getting more. Is it dependent upon the patient's perception, or is it dependent upon their expertise?
I feel there are three factors at play in this particular situation. Number one is the availability, because female doctors are not very comfortable working in the private for reasons. They also have a home to run. They have a house to run, and private takes more involvement than government. And then you do not have fixed working hours in private. So probably that is not very attractive for them, and especially clinical subjects like medicine, surgery, and all that. So availability. Number two, again, the management. The management also feels more comfortable dealing with males, because male doctors will not ask for maternity leave. They will not ask for, they will not want to go home because mother-in-law wants him to come. So the managements are into, they're business people, so they would want somebody who's more comfortable. So generally, unless a female demands her way through, or rather earns her way through by her clinical expertise, her clinical demand, generally the tendency is to employ a male doctor. And thirdly, because some patients, or rather a good number of patients especially from the lower strata of society, they prefer a male doctor in subjects, as I said, other than gynae. So naturally in private sector, they are also there. Another issue, which, or maybe I'll answer that later. I'll bring that up later, because this is the answer. These 3 points are my answer to your present question.
Yes. Dr. Borua, thank you for the earlier answer. My next question is regarding the mental health being affected by this discriminatory behavior. More পিছৰ প্ৰশ্নটো হ'ল এই যেটো লিংগ বৈষম্য চলি আছে, যেটো কৈছে আপুনি চিকিৎসা বিষয়ত মহিলা ডক্টৰৰ প্ৰতি, what could be the mental and professional effects to the female doctors in terms of going through this discriminatory behavior from patients as well as the management?
See, this is actually a psychological trauma. One must remember, a female doctor is a human being first, and no human wants to be penalized for his or her gender. And this is a situation where তেওঁৰ লিংগৰ কাৰণে তেওঁক বৈষম্য কৰা হৈছে। এগৰাকী মহিলাক তেওঁ যে মহিলা অকল সেইটো বাবে তেওঁৰ ডাক্তৰীটোত অলপমান হলেও এটা প্ৰশ্নবোধক চিন আহিছে, আৰু যেটো আসলতে শুদ্ধ নহয়, যেটো হোৱাটো উচিত নহয়। So they get traumatized, and maybe one event is not traumatic, but repeated এনেকুৱা ঘটনা যেতিয়া হৈ থাকে, it keeps on happening, and that adds up. The small psychological trauma adds up, and sometimes they lead to severe frustration. Our frustration or karane মানে discontinuation of job, but loss of interest of job. Or keteba ki hoy, we are humans, we want acceptance, we want recognition. Keteba ki hoy, they are doing very good work, or maybe one male and one female doctor are both doing great work, and unfortunately the male gets more recognition than the female simply because of their gender. তেতিয়াও তেওঁলোকৰ যথেষ্ট ফ্ৰাষ্ট্ৰেশ্যন হয়, আৰু ফ্ৰাষ্ট্ৰেশ্যন হয় ডিপ্ৰেশ্যনতো যোৱা দেখিছো, মই ডাক্তৰী এৰি দিয়াও দেখিছো, যে দে হেভ লেফট দিছ ক্লিনিকেল প্ৰেক্টিছ কমপ্লিটলি এৰি দি পেলাই কিবা এটা তেনেকুৱা ধৰণৰ ৰিলেটেড চাকৰি কৰিবলৈ যায় because they lose the fight in them. They keep on fighting at one point of time তেওঁলোকৰ এনেকুৱা হয় যে কি লাভ হ'ব আমি ফিমেল বুলি আমাক ইমানখিনি ডিসক্ৰিমিনেশন কৰিছে পেশেন্টে কৰিছে মেনেজমেন্টে কৰিছে কলিগে কৰিছে so they finally burn out হৈ যায় যথেষ্ট সাইকোলজিক্যাল ট্ৰমাও হয় আৰু মইতো ভাবো কিছুমানে এন্টি ডিপ্ৰেছেন্টটো খাবলগীয়া অৱস্থা হয়
ধন্যবাদ ডক্টৰ বৰুৱা কথাখিনি আমি আপোনাৰ যেহেতু আপুনি এইবিলাকৰ গৈছে এইবিলাক অভিজ্ঞতা আপুনি আখেৰে গৈছে লিখিছে মই কি সুধিব খুজিছো যে এইটো মেডিকেল প্ৰফেশ্যনটোত আমাৰ মহিলাখিনিয়ে যিখিনি পুৰুষ গোটেইখিনি আটাইতকৈ চোকা মানুহ আছে বৰ্তমান আগৰ পৰাই এতিয়া আৰু বেছি আছে এতিয়া ইমান চোকা মানুহবিলাকে যেতিয়া ইমান ভালকে ৰিজাল্ট পাতিও মহিলাবিলাকে খুব ভালেই কৰে তাৰপিছত দেখে যে প্ৰফেশ্যনেল দিশত তেখেতৰ যিখিনি একচেপ্টেন্স হ'ব লাগিছিল যিখিনি তেওঁ মানি ল'ব লাগিছিল ৰোগীবিলাকে যিমানখিনি আহিব লাগিছিলে তেওঁৰ চাহিদাটো যিমান থাকিব লাগিছিলে তেখেতৰ প্ৰতি যিমানখিনি তেওঁৰ চাহিদাটো হ'ব লাগিছিলে এইখিনি নহ'ল এই বস্তুটো এই বৈষম্যটো আমি কেনেকৈ নোহোৱা কৰিব পাৰোঁ how can you reduce this kind of discrimination when you see the female or as well as the male doctors they are the most meritorious people especially in Assam I'm talking about when they pass out with flying colors with good results in females they have in terms of results they are always equal to the males and when in the coming to the professional field they see that they are not accepted by the patient as well as the employers as well as then it's a very very unfortunate situation going on if it is going on then how can we reduce this particular scenario especially in Assam
no this is something very interesting you have said that amar attaitke soka lora sali bilak medical পঢ়িবলৈ যায় যেটো সত্য কথা which is very true the best students they generally go into medicine but what public perhaps do not know is what happens in medical schools you will find that usually in the top it is always the female students the best medical students are the girl students do better than boy students in most medical colleges in the top you usually have a lot of girls in the top 10 but what happens tar pisot ei obostha ki hoy in spite of their academics being so good they are basic sincere bulio if you ask a medical college teacher they will say that females are more sincere than the boys in learning time ot aha time ot joa extra kam kora wards of evening aha everything a girl a lady student is more sincere then why does this happen the first problem starts when they graduate the family pressure is such that family a medical পঢ়াই পেলাই তেওঁলোকক এৰি দিব লাগিছিল ভাল ডক্টৰ হ'বলে but family at apso start thinking that doctor to pasot প্ৰথমতে she is a girl so she needs to get married so family pa eta pressure dia hoy je don't take up surgery don't take up medicine tohote olop lighter subject ja dermatology ja psychiatry ja jot emergency na thake or gynecology ja so that perception starts from there and some of them get so conditioned into this that they are a brilliant student who they had the choice to take the toughest of the subject or the most difficult subject kitu telke hetule nogoi pelai telke hetu bhabi loi je amar etu daitto so we will marry a surgeon but I will go into pathology enuka hobo pare je jijon surgeon teo class ot hoyto 15-20 number ot ahisil or swaljani 1-2 number ot ahisil that also happens aru etu karone discrimination to shuru hoy aru etu naikia keneke koribo pari now this to abolish this discrimination is a very very tough call I cannot give you a what do you call that magic formula jitwe edinote naikia koribo this can happen only over a period of time and it's a long run process first of all moi bhabo the lady medical students they themselves must resolve that no we are not the weaker sex we are not the inferior sex we can do things as much as any male colleagues of us can do, any male classmate can do. So why should we not become a neurosurgeon? Why should we not become an orthopedic surgeon? First, a effort to ahibo laibo ladies or nijor pra. They must condition themselves. Or tar karone telko parents e koribo lagibo. Moi bhabo hetu society counseling enekwa dhoroner discussions in a more wider scale hobo lagibo. Not only webinars, but moi bhabo je TV talk shows hobo lage, newspaper articles likhibo lage, that the ami okol women's day, year of the girl child eblak potatke practically eblak mane okol medical at isolate kori thole nobo. We need to have engineers, top quality mechanical engineers as females, top quality electrical engineers as females. Society a perception to bodlabo lagibo je women are inferior sex, মানে weaker sex বুলি কয়, but inferior sex বুলি মনে মনে ভাবে। এই বস্তুটো কমপ্লিটলি নাইকিয়া কৰি দিব লাগিব, weaker sex শব্দটোৱে নাইকিয়া কৰি দিব লাগিব, that has to be abolished। আৰু তেতিয়া পেশেন্টক আমি যেতিয়া ডিসকাস কৰো, I think we need to talk in terms of results. এখন হসপিটালে, হি প্রাইভেট হসপিটাল হোক গভর্নমেন্ট হসপিটাল হোক, maybe we should talk about results in the sense that what has this doctor achieved in the last 5 years, কিমান publication, কিমান patient cure কৰিলে, কিমান patient চালে, এইবিলাক যেতিয়া অলপ পাব্লিক ডোমেইনত আহিব, যদি কোনবা এটা ইন্ডিপেন্ডেন্ট সোসাইটি, ফৰ এক্সাম্পল এনাজৰীয়ে কাইলে এটা তেওঁলোকৰ ৱেবছাইটত ৰিসাৰ্চ কৰে যে মেডিকেল কলেজৰ এক্স ডিপাৰ্টমেন্টত ইমান কেইটা মেল ডক্টৰছ, ইমান কেইজন মেল ডক্টৰছ, ইমান কেইজন ফিমেল ডক্টৰছ, তেওঁলোকৰ মাজত দুইটা কম্পেয়াৰ কৰিলে পাব্লিকেশন কাৰ কিমান, কোনে কিমান পেশেন্ট চাইছে, কোনে কি ৰেয়াৰ কাম কৰিছে, এনেকুৱা ধৰণৰ যদি আমি পাব্লিক ডোমেইনত আনিব পাৰো, this will build up the confidence that okay, this lady doctor is good. আৰু এইটো কথা মই ক্লেৰিফাই কৰিব খুজিছো এখিনিতে যে it is not that lady doctors of কোনেও ৰেসপেক্ট নকৰে, নহয়। I can take names. Dr. Ajaya Mohanta is the first neurologist Ohomor, she is still respected in because that's supposed to be a male dominated science, কিন্তু neurology তেখেতক আজিৰ তাৰিখতো তেখেতক অসমে মানি লয়। আৰু তেনেকুৱা বহুত এক্সাম্পল আপোনাৰ ওলাব, যিটো সাধাৰণতে আমি প্লাষ্টিক সাৰ্জাৰীত চাওঁ, যদি ডক্টৰ সীমাৰেখা দেৱী ইজ ডুইং ৱেল, তেনেকুৱা ধৰণৰ বহুত ওলাব। আৰু সেই যিকেইজন সাকসেসফুল ফিমেল ডক্টৰ্ছ ইন নট সো ট্ৰেডিশনেল সাবজেক্টছ লাইক, মানে আমি অকল গাইনী সাকসেসফুল খিনি নাচাই বা অকল পেডিয়াট্ৰিক্সৰ সাকসেসফুল খিনি নাচাই, অন্য ফিল্ডত যিবিলাক মেল ডমিনেটেড ফিল্ডত দ্য সাকসেসফুল ফিমেল ডক্টৰ্ছ খিনিক অলপ প্ৰমোট কৰা হয়, তেওঁলোকৰ বিষয়ে আলোচনা কৰা হয়, তেওঁলোকৰ বিষয়ে webinars কৰা হয়, তেওঁলোকৰ বিষয়ে টিভিত ডিসকাস কৰা হয়, নিউজপেপাৰত আৰ্টিকেল লিখা হয়। I think that is the way ahead, where people will understand that yes, they are as good if not better than their male counterparts. I think that is my solution and my way forward to your answer, to your question rather.
ধন্যবাদ ডক্টৰ বৰুৱা। মই কি এটা লক্ষ্য কৰিছো, মহিলা ডক্টৰ বিলাকে এই বিষয়ে তেওঁলোকে কেতিয়াও প্ৰকাশ খুব কম কৰে। মই মিডিয়াৰ লগত আছো, তেওঁলোকে এই বিষয়টো খুব কম প্ৰকাশ কৰে। বহুত দেখিছো লেখক হ'বলৈ যায়, আপুনি কোৱাৰ দৰে নিজৰ প্ৰফেশ্যনটো ফেমাছ লেখকো হৈছে, কিন্তু কি কাৰণে আচলতে এৰিছে তেওঁলোকে ক'ব নোখোজে। কোনো মহিলাৰ ডক্টৰৰ মই পোৱা নাই অসমত বিশেষকে, যোনে তেওঁলোকৰ গ্ৰিভেন্সখিনি পাব্লিক কৰিছে এই বিষয়ত। কিন্তু আপুনি নিজে ডক্টৰ হিচাপে কৈছে যে এণ্টিডিপ্ৰেছেণ্টটো খাবলগীয়া হৈছে, আপুনি পাইছে। এতিয়া এই বস্তুটো কিয় হৈ আছে? Why is it happening that almost all female doctors are being silent regarding the discriminatory behavior from patients as well as the management they are facing? As you have said that in fact they have been facing, some of them, and some of them are taking antidepressant to reduce their trauma, mental trauma, being discriminated. That's right. So why is it happening in Assam?
This is not just I feel this is not just an Assam phenomenon. This is a international phenomenon. The lady doctors, তেওঁলোকৰ এটা acceptance আহি পৰিছে, তেওঁলোকে এটা মানে হতাশ হৈ পেলাই এইটো কথা ইনফ্যাক্ট ডিনাইলত আছে। মই বহুত আমাৰ লগৰ লেডি ডক্টৰ সধোতে তেওঁলোকে কিন্তু ডিনাইয়ে কৰিছে, কিন্তু মই নিজে দেখিছো এই দিস ডিসক্ৰিমিনেশন হ্যাপেন্স। মোৰ চেম্বাৰৰ ওচৰত মই ডেইলি দেখি আছো, মই সদায় দেখি আছো। মানে লেডি ডক্টৰ সকলৰ কি হৈছে, এটা এইটো একচেপ্টেন্স, তেওঁলোকে এইটো এটা মানে আচৰিত হ'বলগীয়া বা হেতু বেয়া পাবলগীয়া কথা নহয় টাইপ এনেকুৱা এটা এক্সেপ্টেন্স হৈ গৈছে যেনেকুৱাকে অন্য ক্ষেত্ৰতো মহিলাই এইটো মহিলাৰ কাম ঘৰ সাৰা মোচা সাফা কৰা ভাত ৰান্ধাটো মহিলাৰ কাম হয়েই এনেকুৱা ধৰণৰ এক্সেপ্টেন্স এটা যেনেকৈ আহি গৈছে ঠিক তেনেকুৱা আজি চেতন ভগত is an exception যে তেওঁ he is a house husband এই কথাটো এক্সেপচন কিন্তু এই কথাবিলাক লাহে লাহে একচুয়ালি যেতিয়া নৰ্মেল হ'ব তেতিয়া লেডি ডক্টৰ খিনিও এই তেওঁলোকৰ এক্সেপ্টেন্স খিনি বাদ দি পেলাই এক্টিভিজম আৰম্ভ হ'ব আচলতে the lady doctors have to fight it তেওঁলোকে পুনে স্পেচ এৰি নিদিয়ে মটা মানুহে যদি এনজয় কৰি আছে কম কাম কৰি বেছি ডমিনেন্স কৰি আছে বা কোৱালিটি নোহাতকে কোৱালিটি হোৱা এগৰাকী লেডিতকে তেওঁলোকে বেছি প্ৰমিনেন্স পাই আছে তেওঁলোকে স্পেচটো কেলে এৰি দিব সেই স্পেচটো কাঢ়ি আনিব লাগিব আজুৰি আনিব লাগিব and for that they need to get together and voice opinions they have to write instead of resigning to fate instead of resigning from work and shifting profession or shifting to other things they must fight it out তেওঁলোকে তো কম পঢ়া নাছিল তেওঁলোকেও ৰাতি নোখোৱাকে পঢ়ি পেলাই পৰীক্ষাটো পাছ কৰিছে তেওঁলোকে একে কিখন কিতাপ পঢ়ি পেলাই পাছ কৰিছে একে প্ৰফেসৰৰ গালি খাই পেলাই তেওঁলোকে ডক্টৰ হৈছে আমি যেনেকৈ গাঁৱত গৈ কাম কৰিছিলো তেওঁলোকেও তো কাম কৰিছিল so why should they accept relegation into secondary stature তেওঁলোকে হেতু accept নকৰি পেলাই যেতিয়া মহিলা চিকিৎসকসকলে এনেকুৱা ডিমান্ড কৰিব তেতিয়া মই ভাবো এটা পৰিৱেশটো সলনি হ'ব ইয়াৰ উপৰি আৰু এটা প্ৰশ্ন আছে যেটো আপুনি হয়তো এতিয়ালৈকে উঠোৱা নাই ভৱিষ্যতে তেনেকুৱা প্ৰশ্ন আছে যদি মই এতিয়াই নকওঁ হেতু হৈছে sexual harassment সেই বিষয়ে এটা খুব ডাঙৰ ইস্যু এটা লেডি ডক্টৰে ফেস কৰে নাৰ্সেজে ফেস কৰে মই আপুনি যদি প্ৰশ্ন তেনেকুৱা ধৰণৰ সোধে তাত মই অলপ ডিটেইলছত নিশ্চয় উত্তৰটো দিম
Did you find any lady colleague of yours who has confessed about being the subject of discriminatory behavior or sexual harassment because of gender, and that hampers her professional?
Oh, very much. This is a major problem. This is a major problem worldwide. It khub dangor samasya lady doctor facing sexual harassment at work from colleagues, from juniors, from even patients. Lewd comments ba এগৰাকী লেডি ডক্টৰ যেতিয়া প্ৰফেশনত কাম কৰি থাকে তেওঁ হাজ পাৰ কি ঠিক কৰি থাকাটো তেওঁৰ কাৰণে সম্ভৱ নহয় কেতিয়াবা অলপ অসংযত হৈ যায় হেতু সুবিধাটো পেশেন্টে কেতিয়াবা লয় কলিগসে লয় ইনফ্যাক্ট molestationৰ পৰা আৰম্ভ কৰি ইভেন ৰেপছলৈকে ঘটনা ঘটিছে সো work place to 100% safe এতিয়াও হোৱা নাই I am not talking about খুব ডাঙৰ বা it's a very common problem বুলি মই নকওঁ that would be misleading but if you say that it does not exist that is also equally misleading it exists for a female she has to be careful there are some issues aru bihekke when you are in a very high strung or high tension work this kind of things a little bit of tension as on jodi colleague teo konobot lewd comments di thake but teo physicality report comment di thake teo karone কাম কৰিবলৈ সেই টিমটোত কাম কৰিবলৈ দিগদাৰি হৈ যায় বিশেষকৈ আৰু কি হয় promotion ক্ষেত্ৰত যদি the superior is a male and she is female so তেখেতে undue কিবা বিচাৰে বা তেওঁক undue harassment কৰে that is one reason where a lot of females leave job মানে অসহ্য হৈ পেলাই চাকৰি এৰি দিয়া হেতু কমন আৰু কিছুমান প্ৰফেশনত ধৰি লওক এটা সাইকিয়াট্ৰি থাকিলে এনেকুৱা ধৰণৰ হয় the patienter কেতিয়াবা sexual misdemeanor কৰি দিয়ে পেশেন্টৰ লগত মানে ডক্টৰৰ লগত তেনেকুৱা ধৰণৰ ঘটনাও ঘটিছে আৰু বিশেষকৈ ফিমেল ডক্টৰ এগৰাকী যদি কনফাৰেন্সত যায় তেওঁৰ কাৰণেও সেইটো এটা ডাঙৰ প্ৰব্লেম যে when she has because conference she goes alone she cannot be accompanied by somebody a male guard এজনটো লৈ যাব নোৱাৰে তেতিয়াও কিন্তু sexual harassmentৰ প্ৰব্লেম হয় যাৰ ফলত বহুত এৰিয়া মানে তেওঁলোকৰ প্ৰফেশনাল একাডেমিক্স কামখিনি যিবিলাক এখন পেপাৰ পঢ়িবলৈ যোৱা বা এখন কনফাৰেন্সত নিউ লাৰ্নিংৰ কাৰণে যোৱাটো বহুত সময়ত তেওঁলোকে মানে যাব নোৱাৰা অৱস্থা এটা পাই যায় কাৰণ তেওঁলোকৰ এই সমস্যাটো থাকে another thing which is very very interesting and excuse me for saying this so bluntly but I was aghast moi jetia for this talk I was browsing through the net ইন্টাৰনেটত মই চাই আছিলো যে মানে লেডি ডক্টৰ ডিসক্ৰিমিনেশনৰ বিষয়ে তো মই গুগলত টাইপ কৰিছিলো পেশেন্ট এণ্ড লেডি ডক্টৰ ৰিলেশনশ্বিপ আমিতো ডক্টৰ পেশেন্ট ৰিলেশনশ্বিপ তেনেকে বিচাৰো সো I was aghast গুগলত হে তেনেকে সার্চ কৰোতে only মানে pornographic videos দেখা তা মানে a lady doctor is portrayed as somebody who is sexually promiscuous আৰু তেওঁলোকৰ মানে পেশেন্টৰ লগত এটা ফিজিক্যাল ৰিলেশনশ্বিপৰ এনেকুৱা ধৰণৰ বেয়া কথা আমাৰ সো কমন তেনেকুৱা এটা পারসেপশন লেডি ডক্টৰ ইটস সো হিউমিলেটিং সো ইনসাল্টিং that a lady doctor is again considered an object of objectification of a not just a lady doctor is equally objectified ইয়াতকে ঘৃণনীয় কাম একো হ'ব নোৱাৰে আৰু that happens তাৰ মানে পারসেপশন টো এনেকুৱা এজন পেশেন্টৰ কাৰণে a lady doctor is an object of pleasure তাতকে ইনসাল্টিং কি হ'ব পাৰে আৰু হেবিলাক কথা যেতিয়া ওলাই ইন্টাৰনেটত দেখে এগৰাকী লেডি ডক্টৰে বা কোনবাই হেবিলাক কথা কয় তেও নেচাৰেলি হতাশ হৈ যায় she gets depressed আৰু no female wants that হেতু এটা খসাই মাইকী মানুহৰ কাৰণে আটাইতকৈ ইনসাল্টিং is this kind of insult আৰু হেতু মই দেখি পেলাই মই অবাক হলো যে what a terrible perception মানে ক্ৰিয়েট কৰা হৈছে by movies by this kind of what do you call it video industry or movie industry iman terrible at image lady doctor create korise I think that is which is totally unacceptable আৰু সেই কথাটো lady doctor হয়তো কোনেও ডিসকাস নকৰে মই আজি frankly কৈ দিলো because this is something which we don't want to discuss but when you are discussing in an academic forum like this or when I don't think I can sweep this issue under the carpet this also needs to be addressed and হেবিলাক ৰিপোৰ্ট কৰি পেলাই বন্ধ কৰিব লাগে লেডি ডক্টৰ যিবিলাক গ্ৰুপছ আছে তেওঁলোকে এইবিলাকত এক্টিভিজম দেখুৱাই পেলাই দে শুড বি ষ্টপ এণ্ড দেন অলসো লেডি ডক্টৰছ বি টেকেন মোৰ সিৰিয়াসলি
ধন্যবাদ ডক্টৰ বৰুৱা মই কিন্তু এটা ৰেফাৰেন্স দিব খুজিছো আমি সেক্সুৱেল হ্যাৰাসমেন্টৰ ওপৰত এটা ওয়েবিনাৰ কৰিছিলো মাৰ্চ মাহত মই হোষ্ট কৰিছিলো য'ত বাংগালোৰৰ এগৰাকী বহু বছৰ দুৰ্গা নামৰ এটা অৰ্গানাইজেশ্যনত কাম কৰা লিডাৰ তেওঁ কৈছিলে তেওঁ নিজেও হেতু সমস্যাত কলেজৰ পৰাই পাইছিলে মুখামুখি হৈছিলে আৰু আজি তেওঁ নিজেই সেক্সুৱেল হ্যাৰাসমেন্টৰ বিৰুদ্ধে কাম কৰিছে আৰু তেওঁ কৈছিলে সেক্সুৱেল হ্যাৰাসমেন্ট ইমান এটা এপিডেমিকলৈ গৈছে এই ভাৰতত যে মহিলাই যিকোনো হ্যাৰাসমেন্ট এই হওক সেক্সুৱেল হ্যাৰাসমেন্টই হওক যিকোনো হ্যাৰাসমেন্টই মানুহৰ কনফিডেন্সটো কমাই পেলাই আৰু যিটোৱে বহুত মহিলাক কাম এৰিবলৈ স্কুল এৰিবলৈ কাম এৰিবলৈ বাধ্য কৰে as I'm giving a reference of sexual harassment webinar that I hosted in last March where I talked to Ms. Giridhar who has been working against sexual harassment through her NGO Durga in Bangalore and she was telling because she faced it since her college days sexual harassment and she's saying that it's a kind of epidemic people do not want to talk about but it's a kind of epidemic which is creating very negative impact in professional life of women many of women has to leave college schools as well as professional areas because of sexual harassment thank you I think you will refer to that webinar to your female colleagues also আপুনি ৰেফাৰ কৰি এখন ওয়েবিনাৰ আমি চাব পাৰিব আমাৰ এনএছআৰ ফেসবুক পেজত মোৰ ফেসবুকতো এভেইলেবল আছে thank you Borua our next question regarding is the grievance redressal mechanism is it available in your workplace regarding any kind of harassment and discriminatory behavior women face is there a kind of mechanism that is put in place in your আপোনাৰ কৰ্মক্ষেত্ৰত বাৰু এনেকুৱা বৈষম্য আচৰণ বা হ্যাৰাসমেন্টই হওক মহিলা চিকিৎসকৰ ওপৰত তেনেকুৱা কিবা এটা হেৰি আছে নেকি প্ৰক্ৰিয়া এটা আছে নেকি য'ত তেওঁলোকে তেওঁলোকৰ অভিযোগ দাখিল কৰিব পাৰে
হয় আমাৰ যেটো HR ডিপাৰ্টমেন্ট হিউম্যান ৰিসোর্স ডিপাৰ্টমেন্টৰ আন্ডাৰত there is a committee sexual harassment committee আমি অকল তাত মহিলা চিকিৎসককে ধৰা নাই আমাৰ যথেষ্ট সংখ্যক নাৰ্স আমাৰ হস্পিটেলত আছে নাৰ্স সকলে যথেষ্ট হেতু ফেস কৰিবলগীয়া হয় তাৰ পিছত অন্য এটেন্ডেন্ট ৰিসেপশনিষ্ট এইবিলাক আছে যিকোনো মহিলাই যদি তেনেকুৱা কোন ঘটনা ঘটে হস্পিটেলত আমাৰ 5টা ক্যাম্পাস আছে আমাৰ হস্পিটেলৰ আৰু 5টা ক্যাম্পাসৰ যতে হক এই কমিটি টেক্স ইট ভেৰি ভেৰি সিৰিয়াসলি এটা প্ৰপাৰ এনকুৱাৰী হয় আৰু পিউনিটিভ অ্যাকশন হয় আনকি এনেকুৱাও হৈছে যত আমাৰ এমপ্লয়িক আমি পুলিচৰ হাতত গটাই দিছো বিকজ তেওঁলোকে inappropriate behavior with lady patients কৰিছিল বা inappropriate behavior with female colleagues or লগত কৰিছে যাৰ কাৰণে not only we have taken our in-house action but also handed over this guilty to the course of law. So I think that is one very very important that a jikono organization not enekwa ekhon committee thakato sexual harassment committee thakato eta hoise tar karone lady egerke confidence eta pai to work freely in the organization. Secondly jiblak rog jito apuni kole je epidemic hoise which is true a rog employee jibla male employees have a fear je committee khon ase I will not get away with this সেখানে হেতু ভয় থাকিব আৰু I think that committee must exist in every organization and not only it should exist it should be robust আৰু সকলোৱে গম পোৱা উচিত যে there is a mechanism of redressal আৰু এনেকুৱা এখন কমিটি আছে which is very very strict হেতু গম পালে মই ভাবো এই প্ৰবলেমটো 10-20% হলেও কিবা এটা ইমপ্ৰুভমেন্ট নিশ্চয় হ'ব
তাত কোনোবাই বাৰু এটো যেটো লিংগ বৈষম্য আচৰণ মহিলা চিকিৎসকৰ প্ৰতি তেনেকুৱা গ্ৰিভেন্সও দিছে নেকি বাৰু is there any giving the grievance against
yes
discriminatory behavior in terms of her profession
oh yes he discrimination or moi to hetu incidents kolu je amar not only once many times tenka grievance ahise jot jodi minor grievance hoy tete stern warning dia hoise আৰু if it is a physical thing আমাৰ পুলিচতো দিয়া হৈছে মানে offending employee male employee has been handed over to police ইমানখিনি লকে কৰা হৈছে so that law takes its own course আমি যেহেতু punishment decide কৰিব নোৱাৰো that is for the law of the land but যিখিনি আমাৰ in house ধৰিলক মানে খুব বেছি physical হোৱা নাই তেনেকুৱা বিলাকত যত law is not broken but law has been what do you call that অলপ ছেৰছাৰ বুলি যেটো কয় হিন্দীত বা লৰ লগত অলপমান গণ্ডগোল কৰিছে তেনেকুৱা বিলাকক ষ্টাৰ্ন ৱাৰ্নিং বা সৰুখুৰা পানিশমেন্ট যিবিলাক আমি ডিপাৰ্টমেন্টাল প্ৰসিডিংছ বুলি কওঁ ডিপি বুলি কওঁ তেনেকুৱা ধৰণৰ একচনো আমাৰ লোৱা হৈছে and that is natural because আমাৰ ইমানখিনি ফিমেল এমপ্লয়িজ আছে হেতু definitely we do have and we have acted in the past.
Dr. Borua, have you found any gay or lesbian and transgender colleagues as well as participants in your professional life? Apnar jitu sakuri kshetrot apuni paisen ki gay lesbian homokami motamanu manu ba othoba rupantrokami ব্যক্তি আপোনাৰ colleague হিচাপে বা সহপাঠী হিচাপে পাইছে কি আপোনাৰ অভিজ্ঞতা
হয় আমি যেহেতু ট্রান্সজেন্ডারে হক বা সমকামী ব্যক্তিয়ে হক তেওঁলোক সমাজত এক্সিস্ট কৰে they are a part of the society so naturally there will be doctors who are homosexual there are doctors and clinical assistants who are transgender unfortunately society's acceptance to it is very poor this is very very unfortunate so তেওঁলোকৰ হৈছে কি ক্লোজেট হোমোসেক্সুয়ালস কোনো ডাক্তৰ যিমানবিলাক দেখিলো মই লেসবিয়ানে হক গে হক হোমোসেক্সুয়াল তেওঁলোকে ওপেনলি ওভাৰটলি নেদেখায় কাৰণ সোসাইটি তেওঁলোকৰ যদি প্ৰাইভেট প্ৰ্যাকটিস কৰি আছে প্ৰ্যাকটিসত ইট এফেক্টস কাৰণ মানুহে জানে যে ঠাট্টা মস্কৰা কৰে বা এনেকুৱা যিবিলাকত এফিমিনেট ফিলাক বা ট্ৰান্সজেন্ডাৰ যিখিনি আছে তেওঁলোকে নেদেখায় দে কভাৰ ইট আপ কাৰণ হেতু এতিয়াও for whatever reasons acceptable হোৱা নাই but they do exist আৰু তাৰে কিছুমান ক্লোজেট নহয় বা at least colleagues লগত তেওঁলোকে লুকঢাক নকৰে about their sexual orientation কিন্তু পেশেন্টৰ ক্ষেত্ৰত মই এতিয়ালৈকে তেনেকে ওপেনলি যে yes I am lesbian or yes I am gay এনেকে কৈ পেলাই পেশেন্টৰ লগত জনোৱাটো আৰু হেতু প্ৰয়োজনো নহয় কাৰণ পেশেন্টে নখুদেও কিন্তু যাৰ বিশেষে যেটো ক্ৰছ ড্ৰেছাৰ বা ট্ৰান্সজেন্ডাৰ তেনেকুৱা বিলাক যিসকলে more or less cover up কৰি থৈ দিয়ে যেনেকৈ আপুনি হেৰি দেখা পায় ধৰি লওক আপুনি বিউটি ইন্ডাষ্ট্ৰি ফ্যাশন ইন্ডাস্ট্রিত আপুনি যেনেকে দেখা পায় ঠিক তেনেকে মেডিকেল ইন্ডাস্ট্রি বুলি কক বা মেডিকেল প্রফেশনত হেতু ওপেনলি এনেকে ওভারটলি দেখা পোৱা নাযায় ডেফিনেটলি কভার্ড আছে
What should be a heterosexual doctor's perception regarding gay, lesbian, and transgender colleagues? As on বিপৰীতকামী ডক্টৰৰ বাবে তেওঁৰ কেনেকুৱা হেৰি হ'ব লাগে মানসিকতাটো হ'ব লাগে তেওঁৰ সমকামী অথবা ৰূপান্তৰকামী ব্যক্তি কলিগ বা তেওঁৰ সহকৰ্মী কেনেকুৱা হোৱাটো আপুনি বিচাৰে
সব প্ৰথম কথা মই ভাবো দ্য পারসেপশন হৈছে কি আমি মই নর্মাল দে আর এবনর্মাল এই বস্তুটো ইমিডিয়েটলি ফর এভার ডেস্ট্রয় হব লাগে দ্যাট heterosexual is normal and same sex is abnormal it is not কারো নিজৰ কন্ট্রোল নাথাকে যি সকল সমকামীয়ে হওক বা ট্রান্সসেক্সুয়াল হওক তেওঁলোকৰ কিন্তু নিজৰ কন্ট্রোলত থকা বস্তু নহয় নহয় they are born that way they are made that way genetically তেওঁলোকক হৈছে বা কন্ডিশনালি তেওঁলোক তেনেকুৱা হৈছে আৰু হেতু absolutely normal আৰু হেতু society accept কৰা নাই medical profession is a part of the society এতিয়াও হোৱা নাই হেতুৰ কাৰণে যি সকল মই ভাবো হেটেৰোসেক্সুয়াল সকলৰ বেছি দায়িত্ব কাৰণ তেওঁলোকে যেতিয়া দেখাব acceptance মই আজি যদি এই এনেকুৱা ধৰণৰ এলজিবিটিকিউ সোসাইটিৰ লগত কাম কৰিছো বা তেওঁলোকৰ লগত মই এটা নৰ্মেল ৰিলেশনশিপ ৰাখিছো তেনেকুৱা পেশেন্টে হক তেনেকুৱা পেশেন্ট বিলাকৰ লগত মই আতে মোৰটালে আহে বিকজ দে নো মোৰটালে এনেকুৱা আহিছে বা মই তেনেকুৱা এটা গল্পও লিখিছিলো about sex change operation মোৰটালে এনেকুৱা আহিছে যে মাকে লৈছে অসমৰ এখন সৰু চহৰৰ পৰা মাকে লৈ আহিছে ডিসকাস কৰিবলৈ যে জিয়েকক মানে the daughter wants a sex change operation the lower middle class family অসমৰ এখন সৰু চহৰৰ পৰা আহিছিল I was very impressed যে মাকৰ acceptance to আৰু আহি পেলাই মোক কোট কৰিলে থাইল্যান্ডত কেনেকে যাব লাগে sex change operation কি হয় এইবিলাক কথা খুদিছিল I was very elated that day yes at least তেনেকুৱা এটা acceptance এটা lower middle class family আহিছে আৰু আহাটো স্বাভাৱিক আৰু উচিত I think the heterosexual must realize that the homosexuals are as normal as they are there's nothing called abnormal and normal all three genders are at par in everything এই কথাটো যেতিয়া আমি মানি লম as a part of society আৰু মই ভাবো মোৰ নিচিনা ডাক্তৰ যেনেকৈ মানিছো আমি আৰু প্ৰমোট কৰিব লাগিব তেনেকৈ বহুতে মানিব লাগিব আৰু ঠাট্টা মস্কৰা নকৰি সেইটো কথা নৰ্মেল বুলি যেতিয়া মানিম কাৰণ আমি যদি নাজানো people the medical science who understands what is genetics we understand what is psychology we understand what is psychosexual behavior এই সকলো বিলাকৰ সায়েন্সটো আমি আটাইতকৈ ভালকে বুজি পাওঁ আৰু আমি ভালকে বুজি পোৱা স্ট্ৰাটা অফ সোসাইটিয়ে যদি এটো একসেপ্ট নকৰি পেলাই এটা এতিয়াও আমি ডিসক্রিমিনেশন কৰো I think our education is a waste of time. We got a degree, but we did not get education. Jodi ami etialoke sei kotha to nubujo. So moi more male colleagues ba more heterosexual colleagues saboke kau je society perception of you have to rise above and bring about acceptance of what is normal, what is natural, what should be accepted. Aru etu amar notun kotha nohoy dei. This is nothing new. The concept of শিখণ্ডিটো আমাৰ ধৰ্মশাস্ত্ৰত আছে ধৰ্মশাস্ত্ৰত যদি থাৰ্ড জেন্ডাৰৰ কথা আহিছিল থাৰ্ড জেন্ডাৰ বুলি নকয় আজিকালি ট্ৰান্সজেন্ডাৰ বুলি কয় ট্ৰান্সজেন্ডাৰৰ কথা বা ক্ৰছ ড্ৰেছাৰৰ এইবিলাক কথা যদি আমাৰ ধৰ্মশাস্ত্ৰত আছিল আজিৰ সমাজে সেইখিনি মানি নোলোৱাটো মই ভাবো এটা সাথৰ আৰু সেইটো এটা হাস্যকৰ সাথৰ we all should accept আৰু মোৰ কলিগ যদি তেনেকুৱা হয় মোৰ পেশেন্ট তেনেকুৱা হয় মই কেতিয়াও হাঁহি ঠাট্টা নকৰো আৰু মই সেই পেশেন্টক অতি সাদৰেৰে গ্ৰহণ কৰিম তেনেকুৱা কলিগক অতি সাদৰেৰে গ্ৰহণ কৰি মোৰ নিজৰ সমকক্ষ বুলি মানি লওঁ
মই জাস্ট এটা ৰেফাৰেন্স কৈছো আপুনি কৈছে সেঞ্চুৰিজ পৰা আছে মই যিখিনি ট্ৰিবিউনত লিখিছো বা মোৰ নিজৰ গৱেষণাত মই কৈছো যে অকল শিখণ্ডি ৰেফাৰেন্সটোৱে নহয় সমকামী যিটো ভাল পোৱা তাৰ এটা ডাঙৰ উদাহৰণ সমকামী ভাল পোৱাৰ যিটো সেলিব্ৰেশন হয় উদযাপন হয় এইটো ৰাস যিটো ফেষ্টিভেল এইটো দুবাৰো ওলাইছে ট্ৰিবিউনৰ পাতত আৰু মোৰ লেখামেলাত মোৰ গৱেষণাত কেইবাবাৰো মই ৰেফাৰেন্স দিছো সেইটো আচলতে গোটেই ৰাস ফেষ্টিভেলটো আচলতে এটা সমকামী উৎসৱ কাৰণ যিখিনি গোপিনী আছিলে গোপিনী বিলাকে আচলতে এটা সময়ৰ ঋষি আছিলে যোনে বনবাসত থকা ৰামৰ ৰামৰ প্ৰেমত পৰিছিলে আৰু ৰামে কৈছিল যে যেহেতু এইটো সময়ত বা এইটো যুগত এইটো সম্ভৱ নহব তেওঁ বনবাসত আছে তেওঁ দাপৰ যুগত কৃষ্ণ হৈ জন্মিব আৰু এই গোটেই মতা ঋষিখিনি মতা ঋষি আছিলে পুৰুষ ঋষি তেওঁলোক মানে হেৰি হৈ জন্মিব গোপিনী হৈ জন্মিব আৰু ৰাসৰ ৰাতি তেওঁ নিজেই কৃষ্ণ হৈ জন্মিব সেইটো যুগত আৰু ৰাসৰ ৰাতি তেওঁলোকৰ যিটো সপোন আছিল ভাল পোৱাৰ সপোন সেইটো প্ৰকাশ কৰিব আৰু যেতিয়া ৰাসৰ ৰাতি গোপিনীবিলাকৰ লগত ৰাসলীলা কৰিলে তেতিয়া সেই ৰাসলীলা দেখি শিৱ কৈলাশৰ পৰা শিৱ ইমানেই বেছি প্ৰভাৱিত হ'ল যে তেওঁ গোপিনীৰ বেগ ধৰি গোপিনী হয় নহয় বেগ ধৰি তেওঁ গুচি আহিলে যেন ট্ৰেঞ্জেণ্ডাৰ দৰে আচলতে আৰু ৰূপান্তৰকামী ব্যক্তিৰ দৰে নামি আহিলে আহি তেওঁ গোপিনীৰ মাজত মিলি গ'ল আৰু শেষত কৃষ্ণ আৰু শিৱৰ মাজত মিলনো হ'ল এই গোটেইবিলাক ৰেফাৰেঞ্চ আছে আমাৰ শাস্ত্ৰত আৰু গোটেইখিনিয়ে কয় আচলতে সমকামী ভাল পোৱা অভিযোগ আগতেই আচলতে ভাৰতত আছিল ধন্যবাদ what I am saying referring to the same sex behavior as you have given the example of Sikandi that I have been pointing through my writes up in Assam Tribune as well as my personal academic research that the whole Ras festival is actually a celebration of homosexuality because all the sages, those are the gopikas actually, they are the male sages who fell in love to Lord Rama when he was in exile. And Lord Rama saw their devotion and he promised them that he will fulfill their desire in his next birth when he will have a rebirth as Krishna and they will have birth as gopikas and at night, Ras night, they are celebrating love and when they are Lord Shiva was noticing their love making sort of thing. He was so impressed that he came down in the guise of a gopika and ultimately at that night Lord Shiva and Lord Krishna were united and that is the celebration of Ras actually. Many people do not know, it's just for your reference I have said. Thank you, Borua. Regarding the sex education.
I have one question. Dr. Sharma, I have one question. Since you have done research, would the Hindu concept of Ardhanarishwar be something of a transgender or a cross-dresser or something? I do not know. Exactly. I am just throwing this question to you because since you have done a lot of research on this.
You can go through my writes up and some of my published papers in my Facebook page. Thank you for the Ardhanarishwar reference because we have been using that too also because it is also an incarnation of Shiva, isn't it? Obviously. Yes. Regarding the sex education, if sex education then that comprising of mental health associated with sexuality and gender and sexuality education, if that sort of comprehensive sex education is being implemented in India since school onward, do you think our society will be a little bit more progressive, which will have no kind of discriminatory behavior in terms of sexuality and gender, and ultimately that will lead to a happy, peaceful and progressive system? What do you think? যদি আমি যৌন শিক্ষা দিওঁ স্কুলৰ পৰাই ভাৰতত যি যৌন শিক্ষাত ধৰক মানসিক স্বাস্থ্য যিটো জড়িত থাকে মানে সমস্যাবিলাক যৌনতাৰ লগত আৰু লিংগ আৰু যৌনতা বিষয়ক শিক্ষা যদি স্কুলৰ পৰাই যদি কম্পালচৰি হিচাপে দি দিয়া যায় নিয়মীয়া কৰি দিয়া যায় আপুনি ভাবেনে যে লিংগ বৈষম্যবিলাক কমি যাব যৌনতা বৈষম্যবিলাক কমি যাব সমাজখন এখন সমতাৰ সমাজ এখন শান্তি সমাজ আমি পাম এটা সময় এই কি হ'ল
মই উত্তৰটো দিম যে হয় কমিব কিন্তু কিয় কমিব কথাটো মই অলপ কোৱালিফাই কৰিব খুজিছো মই কলেই কমিব হেতুটো নহয় মই এটা ৰেফাৰেন্স ইয়াত আনিব খুজিছো the reference I want to bring is a subject called moral science or moral studies which we had when we were in school. It has been discontinued, and if you notice the moral degradation of the society is somewhat directly related to the abolishment of the subject called moral science. Maybe it is a coincidence, maybe not. Now I feel that moral studies or moral science needs to be brought back in a modern form. Amak etia heri na lage, amak religion nor kotha na lage. We had a lot of religious discourses in those moral studies. We don't need it anymore. We need spirituality, and these kind of things need to be not just sexuality kotha or sex education or kotha. I feel in that subject, in something akin to moral science, we can introduce environment protection. All these issues which are not a part of any particular subject can be taken up as a subject which will enthuse a young student to understand the society in a better note. I feel if you incorporate such a subject, maybe you call it by some other name, moral science or social science or whatever it is, social studies or whatever it is, but I think we need to restart that. And that is sex education, relation of other genders, এই কথাবিলাক আমি সোমাব লাগিব লগতে water conservation, তাৰপিছত pollution বা greenery protection, এই কথাবিলাক যদি আমি environment protection ৰ কথাবিলাক সোমাই দিওঁ, I think this will go a long way in changing the society's outlook in many ways than one. So I feel society must ask the government and the curriculum makers to actually think in these lines.
ধন্যবাদ ডক্টর বৰুৱা, আপোনাৰ বহুতখিনি উত্তৰে আমাক আসলতে বহুতখিনি কথাই বুজালে, বহুতখিনি নিজৰেই দৃষ্টিভংগী বহল হ'ল। Thank you, Dr. Borua, for your answers that has been enlarging my own perceptions regarding medical profession and female doctors scenario in Assam and India, as well as in developed countries. Now it is the time of questions and comments. Is there anyone from the participants who wants to ask a question to Dr. Borua? Dr. Borua is open for question and comments. যদি কোনোবা অংশগ্ৰহী গ্ৰহণকাৰী আছে আমাৰ মাজত যোনে ডক্টৰ বৰুৱাৰ প্ৰশ্ন দিব খুজিছে, ডক্টৰ বৰুৱা এতিয়া প্ৰশ্নৰ কাৰণে ৰেডি হৈছে, প্ৰস্তুত আছে।
Mukul, I'll go. This is Milind Datta. আৰু আপোনাৰ কথাখিনি শুনি খুব ভাল লাগিলে। So I wanted to say two things mainly. I am a trans man. I'm a proud Assamese trans man, and I have been active with LGBT movement in Assam, Northeast. And so jetia mami AMC goisilu, almost I think 2018 not ami goisilu to talk about queer awareness program. We had to wait 3 days to get an appointment. Okay, Friday golu, Friday plus Saturday plus Sunday, Monday 10টা পৰা 2টা বজালৈ wait কৰিবলগীয়া আছিল to meet with the principal. Finally he couldn't say no because we were sitting there, and I was so shocked. AMC Nisna Medical College, Jod Moor Aitai was the first lady matron asile. Moor Aita, it's a very white medical college asile. Moor Aita was the first one. And Moor Aita mane hekane ma goisil medical college. And hey medical college jod swaliye jeans pini jabo nware. This girl had to go, she really want to help us, but she was so afraid. They were so afraid to go against the, principal and stuff like that, and she had to go from her class, go play kapur change kore ahiboligia hoise. Okay, because you're not allowed with jeans itself. Lorai sob kinibo pare kintu swali jeans pini ahibo nware. They have to go and iman purone kolia bhabdhara, forget about talking about queer activism. Swadi common adhikar nai medical college, and you said that medical. I don't agree with you totally though, because I'm an engineer and I do not say that only the top become doctors, but there are other people too. But hey, to bar bela kotha, kintu hey enuka ta field je সব স্মার্ট পিপল থাকে ছোৱালী সবতকে ভাল কৰে তাক ছোৱালী কনফাইন কৰি থৈছে যে তুমি জিন্স পিন্ধি আহিব নোৱাৰা Assam Medical College. We take pride it to be the one of the oldest in whole of Asia. I think that's what they say. First Asia first medical college. So hey to kotha I was very surprised, you know, ki enuka hoisile. But the good part is that we did meet with the students. And we were supposed to meet for 45 minutes. Instead of 45 minutes, we actually sat for 2.5 hours because instead of talking about queer acting, it becomes gender and it becomes a gender issue. And the one girl, I was so happy. The student had said, "Ki India to Prime Minister hoy gol. We already have a Prime Minister, Lady Prime Minister, President to hoy gol. Eti aro ki feminism kori asa." Ene koisile one of the students. The girl stood up and said that etialoke independence of price and occasion for president. He said 45 or whatever. Then he said, okay, how many are women? Then manjone lorajone automatically, you know, heady hople. And as you mentioned, Mojitia Goisilu again 2018 maybe. Our previous year, one lady doctor was raped and murdered in Assam Medical College on duty. আৰু সেইবোৰ কবি যদি আমি এড্ৰেছ কৰিব যাওঁ then rather than talking and teaching the students and the kids and the baby boy, you know, male baby how to respect a woman, instead of teaching that we tell ছোৱালীক আমি কি পঢ়াওঁ আমি লক্ষীশ্বৰীত পঢ়াওঁ and then we do donate কন্যা দান দিয়ে আমি কন্যা দান দিওঁ আৰু এই ডক্টৰ বিলাকেও সেই কন্যা দান you know কৰে আৰু মনে মনে আমাৰ ট্ৰেডিশন বুলি কৰি আছে it is high time we have to ask those question kele to কন্যা দান কৰিব লাগে it's high time we have to ask those question লক্ষীশ্বৰীত আমি কেলে পঢ়িব লাগে because সেইবোৰ পঢ়াই আছো বিষ্ণু এনেকে শুই থাকে ভৰিখনত আমি সৰস্বতী বহাই থৈছো আমাৰ সেইটোৱে পজিশন কৰি থৈছো you know মাইকী মানুহৰ বিলাকক আৰু তাৰপিছত আমি কওঁ যে ৰেপ কেলে হৈছে anyway more to BCA lecture dilo but I was just wanted to bring that point up, you know. The other thing also aru eta kotha kobo gochilu so I live in Minneapolis, so adha homoy moi Minneapolis ot thaku adha homoy so Minneapolis ot thakute there was a doctor Borua. I had to go and look him up. Okay, he was arrested. Okay, a homia doctor he was in jail because he violated women কি বুলি কয় বহুত লাজ লগা কথা কিন্তু হেৰি violated women patient so তাক জেলত থৈছিলে জেলত থৈ পেলাই তাৰ লাইসেন্সও উঠাই দিছিলে ইউএছৰ লাইসেন্স নাই এতিয়া গুৱাহাটীত আহি পেলাই মালিগাঁৱত প্ৰেক্টিছ কৰি আছে এজন ডক্টৰে so how could somebody you know ইয়াতে কেলে ডক্টৰ বিলাকক এপইন্টমেন্ট কৰাৰ আগতে তেওঁলোকৰ ষ্টাডি নকৰে okay I remember I studied in Gujarat. There was a guy doctor and I think he used to check eyes and he had harassed all the students because all the students and he was to get away it asna kobo no hopefully he died by now but anyway and this guy is a young guy etia maligar moi dekhi pale mo google kore photo li pale mo kobat lekhilu ki this guy is was in jail. How can you take action against people like that or make aware ki that is sob mane jane okay and he is in gynae or something like that which is more dangerous, you know. So hetu karone mo khudibo khusilo ki tenuka ami ki koribo paru কি ইহঁতে যাতে তুমি ইউএছৰ পৰা আহিছা নে আফ্ৰিকাৰ পৰা আহিছা য'ৰ পৰা আহিছা you study about the doctor before you appoint this doctors.
Answering your two issues, number one, see whatever happened in that medical college, the medical college doctor, principal, everybody is a part of the society, and society's perception about queer pride has not really changed, and we have to work very hard. I do not put the onus of working very hard only on you or your group, but it has to come from people like us, people, social leaders, and everybody. So that is number one. Number two,
I hope
your
that
point on why was the girl not allowed jeans? Actually, if jeans and t-shirts or open feet are not allowed in the campus, it should be true for everybody. You cannot see, there are places where like a proper club will not allow you a collarless shirt or something of that sort. So every place has its dress code, but then dress code cannot be gender based. If a boy is allowed to wear jeans, then a girl has to be allowed to wear jeans. If a boy is allowed to wear shorts, the girl also has to be allowed to wear shorts. You cannot have gender based discrimination. So I do not support that principle, and I do not agree with it. And I also do not agree of not meeting. In fact, I would have given you priority had I been in that chair, and your team wanted to come and meet me to talk about issues. I would have cancelled my appointments and given you priority, because this is an issue which is close to my heart, and this is a course correction in the society where I get a chance to do some course correction in the society. Then I would definitely grab it with both my hands and give you priority. That is number one. Number two issue which you brought out is a particular doctor. See, there are two ways of looking at it. He was charged, he was arrested, and he served the term in US. He lost his license, and he served for his punishment. I do not know whether it was a frame up, because that's a different country, and India has its own laws. Now, there are two ways of looking at it. Yes, if he's a habitual, he's a habitual offender, and it was not one-off, number one. And number two, he has served punishment. So the idea of sending somebody to jail or giving punishment is to reform that person. So maybe he has reformed. So in Assam, as far as I know, there has been no accusations of anything of that sort against him. So probably any criminal who has served a punishment for his crime deserves a chance in society. Probably society has given him that chance, and that is the law of this land. Law of India, and I'm sure that is the law in US also, that a criminal, once he repents, once he he changes himself, when he served his sentence, probably he gets a fair chance. So maybe that is the reason he is getting a chance. And because the second offense, if he does something of that sort, that will be very, very severe. My answer to that is this. And yes, you're talking about the gender issues. Yes, India jot females in the world itself. Why India? Why Assam only? Why gute world ote jetia female etiao struggle koribo lagia hoy to establish. For example, in Illinois state of your country, the country where you reside, Illinois first lady neurosurgeon hoise 21st century. The first brown neurosurgeon is the first lady neurosurgeon, and she is an SME, Manali Borwa. So that jodi Illinois nisna Chicago nisna jagat jodi lady neurosurgeon hote 21st century palehi. So you can well imagine it exists everywhere. That kind of discrimination exists everywhere. Hetu eta issue. সেইকাৰণে য'ত লেডিজে নিজৰ বা ফিমেলে এতিয়ালৈকে হেৰি পোৱা নাই, ৰিকগনিশ্যন পোৱা নাই, আপোনাৰ অৰিয়েণ্টেশ্যনৰ মানুহখিনিয়ে ইমান সহজে ছ'চাইটিয়ে নিদিয়ে. চ' ইউ হেভ টু ফাইট, আই হেভ টু ফাইট, উই অল হেভ টু ফাইট টুগেডাৰ টু গেট দিছ ৰিকগনিশ্যন দেট উই অল আৰ ইকুৱেল এণ্ড উই অল মাষ্ট বি গিভেন ইকুৱেল ৰেচপেক্ট. আৰু এটা কথা আপুনি কৈছিল যে মই অকল ডক্টৰখিনি চোকা বুলি কৈছে, নাই কোৱা. I think you misread it. I said that all the ones who come to medical colleges are good students. That does not mean engineers or other sectors that students jai nohoy. They are also good, but there are 100 good students, of which 20 or 30 may come to medical, 20 or 30 may go to engineering, 20 or 30 may go to other. Even humanities to brilliant students jai. Hoyto pre-university science top kora manu moi humanities goi bhal lawyer howa dekhisu, ba bhal etu ki koy writer howa dekhisu. So everything is possible. I don't think medical science, but I'm talking average of medical science, medical education at Huma Manubila on average, they are usually the cream of educational society.
Hopefully আপোনালোকে ভাল লাগিলে, hopefully আপোনালোকে আমাক মাতিব through Enazuri or Hukia. We do go to colleges and have been talking about LGBT awareness as well as about transgender and trans issues and stuff like that. We'd love to come to your hospital if you invite us.
Sure.
Thank you. Aru, and just one thing I wanted to add, yes, second chance dia jai, but second chance logote tatu logot ekhon paper dia thake, this person has violated blah 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 thake, আর মানুহে হেবুর জানি পেলাই যাব পারে। ওকে, কোনবা এজন যদি আমাৰ নেইবাৰহুডতো থাকে, there is a notice given to the neighborhood কি ইয়াতে এটা sex offender আছে, because he was a repeated offender. It was not one time, it was repeated offense. So এজনৰ habit to ইমান easily change নহয়, এটা ভালো হ'ব পাৰে, but the thing is that it should be informed to the people so that people can go and see him knowing the fact.
Okay.
Anyway,
okay.
It is really nice talking to you. Hopefully we'll connect.
There's another question, chat out at a question I said directed to me. Can I answer that question, Dr. Sharma?
Yes, please.
Deva Khonai at a prashna khudi says, what are the branches which a lady doctor can opt other than gynecology? I have a reservation with the question itself. Karon ami gutei discussion to korisu je lady doctor or karone kono specific eta heri thakibo nalage. A lady doctor gynecology bahire aru belek ki jabo pare moi bhabo hetu proshnoi hobo nalage. A lady doctor is entitled to go to any subspecialty or super specialty in any subject like her male counterpart. Moi koisu je orthopedics or kotha jitu amar eta mindset ase je orthopedician khodai mota manu, moi bhabo that glass ceiling also needs to be broken, and a lady doctor should go to all subjects, should do everything a male colleague of hers does. Ami gender based ketiao specialty koribo nalage, because medical books to tenekwa kono kotha likha nai aru history to tenekwa kono kotha likha howa nai.
Okay. Is there any other question from any participants to Dr. Borua? Aru konoba অংশগ্রহণকারী কিবা প্রশ্ন আছে নেকি ডক্টর বৰুৱালে? There are some participants who are giving you thanks through the chats.
Yes. Thank you very much. Thank you.
Yes. If there is no other question, then we should close the session. Dr. Borua, we are really grateful to you for joining us and giving us lots of insight. See you again. Thank you, Dr. Borua, and hearty congratulations too for finishing this very interesting topic, discussing the topic. And thank you all other participants for joining us, for being patient for this evening session. And thank you, Kasmira, for your technical help that has been helping us. Thank you all.
Thank you, Dr. Sharma. Thank you, Team Enazuri. Thank you, all participants. It was my pleasure.